I would genuinely request all the parents. See, it's really an honor for me that you believe on what I'm guiding you. And then God helps me to ensure that what I'm committing to all of you, I keep my promise. But in my research and in all these years where by the associates with your hard work and with the help of research which I did, the of everything. The most important factor, a reanalysis every 6 months. Wherever the parents miss that 6 months frame, the problems they start to arise. Because kids, now I do that in phases, and those phases are in a time frame of 6 months. And for the first time, my team tells them that see, if you are to get treatment under Dr. Sharma, it has to be on six months basis. It becomes tough for the parents to believe. The time the parents will tell their coordinator or the C is of something, because I do not chop and change on what I have been doing thousands of. On the contrary, when within the first 6 months, generally the parents they start visualizing some improvements, and many of them see drastic changes. It becomes them that please do not take medications without meeting me, either through a virtual meet or through a physical meet. That meet after every 6 months and that analysis after every 6 months is of most, even if we are too satisfied with the treatment, that meet is really we will carry the for a longer duration of time, although it will not cause any harm, but then it will waste our child's time. So meeting is important. So in this case also, as it has been mentioned that it is more than six, could be through your coordinator. May is very far away as of now. We need to connect. We need to analyze on what is being done, what the psychologist is in those sessions, what are the targets. Now, those all things are really very important. So my genuine request, reach out to your coordinator to ensure that it is not further delayed. One of the support system around the globe, despite because the country, the government is giving you full support for your psychotherapy sessions. They are important. But even more important than that is to understand a slot for those complementary psychotherapy sessions in NHS, or we get a support system from the government. We don't have to pay out from our pockets. Does that autism can be cured? Is there any case study which they have where a child who was non-verbal, too hyperactive, aggressive, a child who was not having that good eye contact, after a particular course of treatment with that psychologist, that is why it becomes important for us to realize is merely by saving out some money, are we not robbing out a child from the chance being an absolutely normal life? I really feel that any cost will be worth it. There is nothing more important than human life. So if by our efforts and if with the research we did in thousands of kids and we have case studies of so many of them, I really feel that someone who is educated enough, there is proof. I don't for that free treatment from NHS. Everything that comes free is required at that time. Unluckily, the entire world Does Ayurveda who have done miracles, the treatments which they are no less than miracles. But having said that, is taken as the mainstream medicinal treatment. So either for us or for anyone else, it's not possible. So what we have done to ensure that if someone needs an insurance claim, he gets an insurance claim in his, that he is doing anything unethical, he can have that confidence. In any country where we are working, we always do it in association with the organization which is registered with the with the doctor. In fact, one of the leading psychologists with me, with my experience, discussing things with him, ensuring with my backend team that Walker Shukla, someone who is one of the registered in London. Similarly, for registered applies as far as that country is concerned, and any one of you is consulting is without the fear that someone who is not registered in your country, someone like that. So, although not directly possible for Ayurveda to be registered anywhere, you have registered people. Which is done for your child in London is as per the guidelines. My concept of treatment. Now, what is my concept? The concept which I developed in all the herbs which are to a particular receptivity and positivity level, to an enhanced concentration level. Those herbs reduce the irritation in a child. And then with the irritation which those herbs have done, we change and modify the behavior of the child. Those modules which I have developed, and then I have trained my team to only give herbs, and they tell us that we are going for some sessions near our house or our child is not still we are expecting for a child to come out of autism, that becomes tougher. So my genuine request to all of you, please do remember, if we really want that what I say in all those lives, what I say in a phase in the life of a child, if treated timely, if we really want that to happen, it becomes so very important that the right techniques which my team guides. So please don't do it partially with us. Do it completely with us so that we can live up to our promise, and so that the child, your child, whom you have handed over cases where your company has in your plan promised you international from best people from UK from take treatment, then you will have to discuss with your insurance provider, and then you can have the bill reimbursed. We have all the certifications for that, but your plan should be having also. You're having a genuine plan, they will give you proper reimbursement for your Ayurvedic treatments. And yes, we are cashlessly impaneled also with certain companies, but still the cashless thing becomes tough for you. You can leave all the other tasks on a side. There is nothing more important than ensuring the immediate attention, a child, immediate support, we make the child keep waiting for that. That is not justifiable. Every increasing month of your child's age is going to further delay the speed at which he will come out of autism later. Asked about stem cell therapy. Stem cell therapy is something which is really very good if the brain is having any kind of damages in it, or if the child was a delayed cry case, if we report to the brain and there is an associated damage which is visible in the PET scan or the MRI, there the stem cell will work. Unluckily, in majority of the cases who come to us, stem cells are done without any reason. The parents don't even go for a prior MRI and still go for a stem cell therapy. Again, homeopathy, Ayurveda, I am no one to comment on what others are doing. Be it homeopathy, be how many cases for them have till now come out of autism? You can ask the same question from us. You can ask case studies from us, and we are totally medicine. I had a PhD and then I submitted that research in multiple universities, including Middlesex University, London. It was accepted, and then now currently by the grace of Almighty, I am a DLED scholar. The reason for that, anything which I am doing for your child through my team by the grace of Almighty is not a trial. It's a well-researched different concept and no one other is doing that one. That is why you want that if you started with us, read about us, read about me, get thoroughly satisfied, and once you are satisfied, then what I am demanding is 6 months of your faith. Because within 6 months, once you start, visuals motivate you to keep doing what we are guiding. So it is only for the first 6 from the guiding. After every 6 months, we are supposed to be meeting, and if I can make it out from India to UK, then still we are not making ourselves available over there. I don't feel that there is anything more important than meeting in this case. One seeing problems at some juncture. Another very noticeable thing which I just noticed over here was 16 ABA sessions. The number of sessions Ayurveda and ABA, not just Ayurveda. And the minimum number of sessions for 6 months of ABA, 24. The advisable number of sessions, if we feel that a child is not sleeping, that means his energy is not being utilized. At least 40 of ABA. One way of making him sleep is piling up his body with a lot of sleeping things. Another way of making him sleep is ensuring that we utilize his energy. We channelize his energy. We need to tire up his mind. We need to tire up his body in a positive way. And the only way in which it can be done is again that we increase the number of ABA sessions. For the bowel, I will now have to examine his bowel. Because if we feel that he's having off and on loose thing of session where exactly it is for the child. And yes, I would also like to know what are the aspects we have some improvements, what are the aspects in which we want some improvement, but all those can only be done here virtual important, and that is something which I feel should be done over here. Yes. Till the time we can meet, since you are facing sleeping problems, you can supplement which will help him to sleep. So if melatonin with side effects is not giving you those results, he at 9 years of age can take 10 ml of Breno D at night.
Of a child if treated timely.
This is the case study of Parth, a 3-year-old child diagnosed with autism. At a very young age, Parth showed multiple developmental challenges. Chief complaints: speech delay, hyperactivity, irritative behavior, less interaction, poor understanding, Parth's detailed medical history was documented and evaluated. Consulted Dr. Navdeep Sharma and felt confident about the scope of treatment. A personalized Ayurvedic treatment approach was planned using specifications to select. Braino A Braino A plus, supporting calmness. Braino A enriched with Shankpushpi, Brahmi, Shatavari, Bringraj, Shunti and Vacha. Cucurbita oil, supporting nourishment and neurological health. Mukta Pishti, supporting and reduce irritation. Before treatment, Parth often showed irritative behavior and did not respond clearly to instructions. Within 9 months of undergoing treatment from Dr. Navdeep Sharma, Parth showed significant improvement.
कलर करो, वेरी गुड पार्थ, कलर करो. नो, इस हैंड से करते हैं, इस हैंड से, राइट हैंड. वेरी गुड. दीदी का हैंड करो. वेरी गुड पार्थ. चलो. वेरी गुड. खाओ. वेरी गुड. पार्थ तो बहुत कम.
Hello parents, Parth, say hello, say hello. This is Parth, my son, he's about to turn 4 years old. Last year in July we went to Dr. Navdeep Sharma sir. A sir had told me about him. We never imagined that in just 9 months Parth would start saying mama and papa to us so soon. As a mother, as parents, we always longed for the day when we would hear Parth say mama and papa. Today Parth says mama, papa and everything else with understanding. By God's grace and with Sir's medicine and guidance, in just 9 months, Parth is now living a near normal life. And Parth was also in playgroup at school. Just 15 days ago, the teacher at school said that Parth will be moved to nursery, and the happiness that Sir has brought into our lives, what more could parents ask for than to see their child improve so quickly and so well? For parents, this is truly a big thing. Thank you, Sir. Thank you very much for bringing such great happiness into our lives. Thank you, Indian Roga.
Call now to connect with Dr. Navdeep Sharma and gift your child autism-free life.